Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about the very first sign, symptom of fatty liver disease. What is the disease of a fatty liver? Fats build up in the liver, which is what causes fatty liver disease. The liver is the largest organ inside the body, and it does many things. This includes helping the body digest food, storing energy, and metabolizing fats, carbohydrates, proteins, and drugs, which means breaking them down. It only stores a small amount of fat most of the time. Fatty liver happens when the amount of fat stored in the liver is more than 5 to 15% of its weight. This is called steatosis in medicine. Fatty liver disease comes in two forms. Alcoholic fatty liver disease is caused by drinking a lot of alcohol over a long period of time. The liver breaks down the alcohol you drink so your body can get rid of it. In the process, harmful byproducts hurt liver cells. The damage gets worse as you drink more and more. Fatty liver disease is the first type of liver disease caused by drinking too much. If you keep drinking, it can lead to hepatitis and then cirrhosis, which is when the liver scars. Non-alcoholic fatty liver disease (NAFLD) is a type of liver disease that is not caused by drinking alcohol. It's not clear what makes this shape. In the United States, NAFLD is the most common type of long-term liver disease. There are two forms of NAFLD. The first is simple fatty liver, which means that fat has built up but there is no inflammation or damage to the liver. Non-alcoholic steatohepatitis, NASH, is the more serious form. It is marked by inflammation and damage, and it can lead to cirrhosis or liver cancer. People who drink a lot of alcohol are the only ones who get alcoholic fatty liver disease. Non-alcoholic fatty liver disease is more likely to happen to people who are overweight or have conditions like type 2 diabetes that are linked to being overweight. The risk grows as people age. Fatty liver disease, also known as non-alcoholic fatty liver disease, NAFLD, is a condition in which excess fat accumulates in the liver. The condition can range from simple fatty liver to a more severe form known as non-alcoholic steatohepatitis, NASH, which can lead to cirrhosis, liver failure, and other serious health problems. In many cases, fatty liver disease does not cause any symptoms in its early stages. However, some people may experience the following early signs and symptoms. Fatigue. People with fatty liver may feel tired or have low energy. Abdominal pain. Some people may experience pain or discomfort in the upper right side of the abdomen, where the liver is located. Weakness. People with fatty liver may feel weak and have trouble doing physical activities. Weight loss. Some people may lose weight without trying, especially if the fatty liver has progressed to NASH. Elevated liver enzymes. A blood test may show elevated levels of liver enzymes, which can be a sign of liver damage. It is important to note that these symptoms are often nonspecific and can be caused by a number of other conditions. If you are experiencing any of these symptoms, it is important to see a doctor for a proper diagnosis. Most of the time, neither type of fatty liver disease has any signs or symptoms. People with fatty liver disease can sometimes feel tired, uncomfortable, or in pain in the upper abdomen. Early on, there aren't any specific signs of fatty liver disease that would require medical care. Because of this, doctors often find it when blood tests or imaging exams done for other reasons show a problem. The best way to treat fatty liver disease depends on the type of disease. Stopping drinking is the best way to treat alcoholic fatty liver disease. The best way to treat NAFLD is to lose weight. Some people with NASH may be able to get a new liver. Fatty liver disease can lead to cirrhosis and liver failure if it is not taken care of. What do people with fatty liver disease feel like? Fatty liver disease is usually a silent disease, which means that it doesn't show any signs. Most of the time, the symptoms of fatty liver disease are not very clear. Some of the signs and symptoms are tiredness, an enlarged liver, and pain, fullness, or discomfort in the upper abdomen. Common symptoms of NASH and cirrhosis. Symptoms of fatty liver disease that has progressed to NASH or cirrhosis can include confusion and extreme fatigue. Jaundice is when the skin and eyes turn yellow. nausea, stomach, ascites, and leg swelling, edema, loss of weight or loss of hunger. Since there are usually no signs of fatty liver disease, it is often found when testing is done for something else. Doctors may find it when regular blood tests show problems with the way the liver works or when they use imaging tests to look for other health problems. Getting regular medical care can help find any problems with the liver early, when it may still be possible to protect it. What makes liver disease happen? Heavy drinking is what causes fatty liver disease in people who drink a lot of alcohol. This means that, on average, women have more than 1 drink a day. On average, men have more than 2 drinks a day. It's not clear what causes NAFLD. Doctors can't tell in advance who will get fat in their livers and who won't. They also can't tell who will go on to get cirrhosis or a worse form of liver disease. But there seems to be a connection between NAFLD and other health problems. This includes being overweight, having type 2 diabetes, metabolic syndrome, or having high levels of triglycerides in the blood. What makes someone more likely to get fatty liver disease? In addition to being overweight and having metabolic syndrome, there are other things that can make it more likely to get NAFLD. Being middle-aged and older. Some drugs, like corticosteroids and some cancer drugs, can make you sick. Obesity, where most of the fat is in the belly. Other health problems include high blood pressure, polycystic ovary syndrome, PCOS, infectious hepatitis, sleep apnea, and a thyroid or pituitary gland that isn't working as well as it should. The risk of NAFLD turning into NASH, hepatitis and liver cell damage from fat, is higher in older people, people with type 2 diabetes, and people with a lot of fat in their bellies. Getting less likely to have fatty liver disease. You might be able to lower your chance of getting a disease by changing the things you can. This means that people with alcoholic fatty liver disease should drink less or not at all. For NAFLD, healthy living is the most important thing. Eating a healthy diet with lots of fresh fruits and vegetables, whole grains, and healthy fats. Most days of the week, doing physical activity. Keeping your body weight at a healthy level. Talk to your doctor about ways to lower your risk of fatty liver disease if you have risk factors for it. Find out what goals for exercise and weight are right for you. If you need help reaching your goals, you could work with a registered dietitian or a personal trainer. How do you treat fatty liver disease? There are no medicines that can be used to treat fatty liver disease in a specific way. But this is an area of research that is still being done. Instead, treatment for fatty liver disease focuses on taking care of the underlying cause and other conditions that are related to it. This means that if you have alcoholic fatty liver disease, you need to stop drinking. This isn't always as easy as it sounds. Most people need help to stop drinking forever. Talk to your doctor and find a way to get better that works for you. To treat NAFLD, the goal is to lose weight. About 10% of your starting weight is the best amount of weight to lose. But even losing 3 to 5% of your body weight can be helpful. If you lose weight, the amount of fat in your liver will go down. This will help you deal with many of the conditions that come with NAFLD. If your NAFLD is caused by something else, like a medicine, your doctor will also take care of that. As part of your treatment, your doctor will probably also suggest a fatty liver disease diet. By cutting out bad fats from your diet, it will help you lose weight and protect your liver. In general, this diet doesn't have a lot of fat in it. It also puts unsaturated fats and omega-3 fatty acids in place of saturated fats and trans fats. It also cuts back on simple sugars and foods with a high glycemic index. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.